is Jara, and today I will be assisting a patient using the bedside commode. So for my assessment, I would like to first review the chart of the patient and see if there's any limitations that will prohibit this patient in doing this physical activity. So just check the chart and see if this patient is ambulatory, see if the patient will be able to do this procedure successfully. And then for my planning, I would like to make sure that all my equipments are in the room. Just put the bedside commode by the bed or in the room, that way it's easier for you to get. And then some supplies needed like toilet paper or and gloves or PPE needed. Or and if you need some assistance from your coworker or from other staff members, just plan ahead and get that assistance before doing this procedure. So for my implementation, I would like to do my hand hygiene technique first. So I would wash my hands. And if I would need to don on my PPE, I would do so at this period. So if I need to put my gown, I would do that at this time. And then after that, you would like to identify the patient using the full name and date of birth. So in my case, I've identified my patient's full name and date of birth. So ma'am, I would just like to verify your information needed for me to do this procedure. May you state your full name and your date of birth? So after the patient stated that for me, you would like to check your chart and then just do some, give the patient some privacy. So close the doors, the windows, if possible. That way it's more easier for the patient to do this procedure because they are exposing some sensitive parts of their body. Then explain to the patient what you're going to be doing for this procedure. So ma'am, my name is Jara and I will be assisting you using this bedside commode so that you will illuminate better. So just make sure that this patient understand what you're doing, and if you need assistance from them, you could also instruct them to do so. And then you would like to place your bedside commode by the bed, parallel to the bed, and just lower the bed according to the level of the commode, and then lower the handrails as well. That way the patient is ready for you to stand. And then once everything is ready, you would like to raise that seat cover or take out that seat cover if depending on your bedside commode. And then just assist the patient to get up in a standing position. So ma'am, I will be assisting you to get yourself ready so that you will be standing up, and then we could transfer you to the commode, okay? So just assist the patient to sit at the edge of the bed, and then this patient is ambulatory based on my chart, so she'll be able to get up by herself. Just, offer some assistance if needed. So after the patients get up, you would like to pivot them to the commode, help them there, and then instruct them to place their arms on the arm rails of the commode. That way they could help themselves lower them very slowly. So ma'am, please hold on to the arm rail so that you could lower yourself to the commode gently, okay? So once they do that, they're safely on the commode. Just offer them some blankets so that you could provide additional privacy for the patient. So in my case, I would have my blanket with me. So this is for their comfort. And then after that, you would like to offer them the supplies they need, tissue rolls. Put it at the area where it's within reach for the patient, and then offer assistance. Get the call light button, place it to within their reach or give it to them. Just put it here on the side, and then you can leave the patient just to give them a little bit more privacy. And after a few minutes, you would like to check on the patient and see if they're done. And then once they're done, you would like to assist this patient off the commode. So when doing that, you would like to perform your hand hygiene technique again. And then you would like to place some gloves, clean gloves, doing this procedure. Because you will be dealing with bodily fluids, so you would like to protect yourself as well. And then once you don on your gloves, you would like to assist the patient in a standing position. If the patient needs some assistance, like cleaning themselves, you would like to get some tissue rolls. So this is my tissue roll. I would like to wrap it on my hand, what I'm going to be using to wash. And then once you have that on your hand, you would like to start on the pubic area towards the anal area. So we would like to do a front to the back stroke or position. So The reason why we're doing that, because you don't want to cross-contaminate, because in the area that the patient have eliminated, especially in the anal area, it's a very, there's a lot of bacteria and microorganisms that you could introduce um, uh, to the front area, which, you know, most likely if a female, you might cause like a urinary infection to them. So you don't want to direct any bacteria to the front, okay? So once you've done the front to back, you would like to check if it's clean or not. If not, you would like to get another roll, put it on your hand, and then do the same stroke from front to back, from pubis to anal, and then check if everything is clean. Once it's clean, you would like to throw this in the proper receptacle. You don't want to throw this in the commode because sometimes you need to measure those urine output or get some specimen that the patient had. You don't want to contaminate that specimen. So you would like to discard this in the trash. Just make sure that you do one roll of tissue on your hand and one stroke, and then discard, and then get a tissue roll again, a clean one, and then do the same procedure until you're done. You'll want to do one of each stroke. And then once everything is good, you would like to assist them in putting their shorts together, get the patient to stand up so that you could transport them again back to their bed. So just make sure that you take off this dirty gloves, because you already contaminated that when you're doing your hygiene. And then just assist the patient to stand up, and then just get them back to the bed, and then just lay them back or in their comfortable position, and then cover them with the blanket. And then just ask the patient if they need anything else. Just offer them some alcohol-based rub, just to clean themselves, like the hands and stuff like that. So offer them some, wet wipes or anything that they could use to clean themselves. And then after that, you would like to wash your hands, perform your hand hygiene. And then you would like to now, get that specimen that you need, if you need some specimen from this patient. You would like to get a new set of clean gloves. And then take that urine to transfer it to a graduated cylinder. Just make sure that that graduated cylinder have some, measurements. That way you could put in the correct measurement on your charting. And then once you've determined that, or if you need some specimen sent to the lab, you would like to get a specimen bottle and then put that specimen in there and then send it to the lab. Then after doing so, you would like to put that aside and then clean this commode properly. Just make sure that you disinfect this. That way it's ready for the next patient or for the next, if you need this in the future use. So take off this dirty gloves, put it in a proper receptacle, perform your hand hygiene technique, and then evaluate and check again if the patient needs anything. Just offer some assistance if they need so. And then document all your findings. Document that you sent out some specimen to the lab, what time, what date, and also what procedure you did for this patient, what time, and then if they were able to tolerate this activity or not, if there's any pain or any discomfort when you're doing this activity. Just make sure that you document all your findings when you're doing this procedure. So that would end my return demonstration for if I'm assisting the patient using the bedside commode. Thank you and have a good day.